Hey y'all, it's Dr. Lakeisha Watson, an epidemiologist and data storyteller, translating data into public health insights for Black women. Welcome back to Epi Fridays and to our Black in the Day mini-series for Black History Month. All right, so when it comes to health, we don't always talk honestly about why mistrust exists or what actually created it. And two names always come up, Tuskegee and Henrietta Lacks, and that's exactly what we're talking about today, so let's get into it. The Tuskegee syphilis study began in 1932 and lasted for 40 years, and Black men were told they were being treated for bad blood, which was a vague term used at the time for multiple illnesses. But what they were actually a part of was a long-term study observing untreated syphilis. And even after penicillin became the standard treatment in the 1940s, the study continued and treatment was intentionally withheld. What makes this story important for health isn't just what happened, it's how long it went on, who was involved, and how normal it was within medicine at the time. And when the study was finally exposed in the 1970s, the harm didn't stop there. Research has shown that after Tuskegee became public knowledge, Black men were less likely to seek medical care, less likely to engage with preventative services, and experience increases in preventable mortality. And those changes have real consequences for people's health. Now, the story of Henrietta Lacks shows a different side of the same problem. In the 1950s, informed consent laws as we know them didn't exist, especially for poor Black patients receiving care in segregated hospitals. Henrietta Lacks was treated for cervical cancer at Johns Hopkins, one of the only hospitals that would see Black patients at that time. And during her cancer treatment, her cells were taken without her knowledge or permission, and those cells, later called HeLa cells, became the foundation of modern biomedical research. And I'm talking they were used to develop the polio vaccine, advance cancer therapies, and make major breakthroughs in genetics and virology. But while the medicine moved forward, her family was left behind, unaware, uncompensated, and often unable to access care themselves. And Henrietta's family didn't learn about the cells for years. Now, why exactly does this matter? Black people have often been essential to medical progress without being protected by it. Black communities have often been positioned as sources of data, but not beneficiaries of health advances. So we carry the risk while others receive the reward. Now, here's where the story connects to today. When we look at current data, we still see patterns that echo this history. Black patients are more likely to have their pain dismissed. Black women are more likely to experience severe complications during pregnancy and childbirth. And Black communities are underrepresented in clinical trials and overrepresented in disease burden. So when we ask more questions, seek second opinions, or hesitate within medical spaces, that behavior didn't come out of nowhere. It was shaped by history, reinforced by experience, and confirmed by outcomes people can see in their own lives. And so what often gets labeled as mistrust is really memory, passed down, lived through, and validated over time. So what I see isn't confusion or fear at all. I see people responding to patterns they've watched play out over generations. And if we want different health outcomes, we can't just tell people to trust. We have to change the systems they're responding to. All right, y'all, that is this week's Epi Fridays, and that's Black history connected directly to Black health. I will see y'all next week where the conversation continues. Bye.